as Dr. Gaspin said, my name is Emily Parsons, and I'm going to be discussing the dermatological disease called canine demodicosis. There are several forms of canine demodicosis. There is a localized form, which is defined as 1 to 5 focal lesions and usually occurs in dogs between 3 and 6 months of age. 90% of the time, this form of demodicosis goes away on its own and needs no medical treatment. There's also a generalized form of demodicosis. This is defined as 5 or more lesions or an entire body region, such as 2 entire feet or an entire head or muzzle. Generalized demodicosis can actually be one of the most severe skin diseases in dogs. It often becomes chronic or resistant to treatment. There are 2 onsets of generalized demodicosis. There's a juvenile and an adult onset. However, recent research has discussed that a true adult onset may be very rare, and it may usually be a juvenile onset that has gone undiagnosed or untreated. There can also be severe foot infections or ear infections caused by these mites. We're now going to explore a little bit more about the disease. Demodex canis is the most common mite that causes canine demodicosis. It's present in small numbers on the normal flora of healthy dogs and is transmitted from the bitch at 2 to 3 days of life. We don't know why with some dogs these mites cause no problems at all. Some dogs get a slight irritation, and some get very serious disease. There are many theories that have been discussed regarding this. Maybe an immune system defect, hereditary component, or a chronic disease. These are all possibilities. I'm going to speak more about the immune component since this is quite a hot button issue in dermatology today. Now, many practitioners, as we know, when we see a dog that is red, itchy, with inflamed skin, we may give it a dose of steroids and that goes right away. However, with demodicosis, there's already an underlying immune defect, so steroids will only make it worse and should never be advocated in the treatment of canine demodicosis. With canine demodicosis, there's an underlying T-cell defect, which is allowing the mites to proliferate to large numbers. There have been many aspects of the immune system studied in the disease of demodicosis. One possible idea is that IL-2 receptors are decreased, and there's also a decreased production of IL-2. Now, IL-2 drives the immune system towards cell-mediated pathways, and therefore this less production of IL-2 could cause this T-cell defect. Oxidative stress has also been implemented, and free radicals are actually produced by Demodex mites. Those free radicals build up and cause a state of oxidative stress. This oxidative stress decreases immune function even more, therefore allowing mites to proliferate, and it's a vicious cycle that just continues. Now, clinical signs for canine demodicosis are your typical dermatological dog signs: scaling, crusts, papules, pustules, redness, erythema. There's also a deep folliculitis and furunculosis, which is an inflammation of the hair follicle that actually ruptures into the dermis. This can lead to a deep pyoderma, lymphadenopathy, and even a septic infection, which can be very serious. Now, for treatment of canine demodicosis, this can be quite controversial. There is only one FDA-approved treatment for canine demodicosis: Amitraz or Mitaban. This has recently been taken off the market. Even when it was available, there were many negative side effects, and it was not always the first choice. Sedation, pruritus, bradycardia can all be side effects because Amitraz is an alpha-2 agonist. It was also controversial because it can even be dangerous to the owner who does the Amitraz dip for their dog. There are many new treatments being explored, and one of the most popular is macrocyclic lactones, used off-label. And again, as we mentioned, steroids should never be used. Macrocyclic lactones used off-label. Macrocyclic lactones are already used by most pet owners to control heartworm disease, but at a much higher concentration, more frequently, they can be used for canine demodicosis. However, we must choose these carefully, especially in the dogs who have ivermectin sensitivity, such as our collies or our herding dogs. There are many other therapies that are currently being explored. There's Amitraz collar, which is a little less dangerous to the owner. vitamin E and hydrotherapy and other kinds of homeopathic therapies, and even selamectin, which didn't prove to be very effective, but was used nonetheless. The prognosis for demodicosis, it's absolutely impossible to tell which cases will go away on their own, which cases will progress, and which cases will become chronic or maybe resistant to treatment. 10% of canine generalized demodicosis will never obtain a permanent cure, and there's always a possibility of future recurrences, even with a cure. So in summary, canine demodicosis is a normal skin flora and also a debilitating dermatological disease. It likely involves both immune and hereditary components. There's a wide range of clinical signs. As Dr. Bauer, our dermatology teacher, says, Demodex can look like anything, and new treatments are constantly being explored. I'd like to thank the following people, and now I'll open up the floor to questions. Dr. Dunaire.
How can you tell if you have an ivermectin sensitive dog?
That's a great question, Dr. Dunaire. Dr. Dunaire asked how you can tell if you have an ivermectin sensitive dog. You can't just by looking at it, and a lot of people think you can. A herding dog or a collie, it's got an ivermectin sensitivity, but that's not the case. We've all heard white feet don't treat. Not necessarily true. There's actually Washington State does a test to see if there is a true ivermectin sensitivity. So what I would recommend is if you have a dog with generalized demodicosis, having that test done, because the positives of ivermectin treatment in a Demodex dog may really outweigh the small inconvenience of getting that test done. Does that answer your question, Dr. Neal? Dr. Roberts?
So what is ivermectin sensitivity?
I am glad you asked that. Dr. Roberts asked, what is ivermectin sensitivity? And ivermectin sensitive breeds start to have side effects at about 100 micrograms per kilogram. Now, for heartworm treatment, we give them about 6 micrograms per kilogram. And Demodex treatment is anywhere between 250 to 600 micrograms per kilogram. So obviously, it's a huge difference. Now, with ivermectin-sensitive breeds, they have a defect in the MDR1 gene, which is causing the P-glycoprotein to not function properly. Now, the P-glycoprotein is what transports drugs from the brain back out of the brain. So this defect causes more of an accumulation of that drug in the brain. Does that answer your question, Dr. Roberts?
Yes. The second part to that, are there other drugs that these dogs are sensitive to other than ivermectin because of this MDR?
Absolutely. Avermectins, even some dogs have shown to be sensitive to the selamectin. All the drugs that are kind of in that same group can have problems, maybe less likely than the ivermectin in the research that I've been reading. But I would say if you have an ivermectin-sensitive dog, I wouldn't risk it with any of those. The avermectins, the milbemycin, even though milbemycin you could maybe
What
have
about
a
other
little
classes of drugs that aren't anti-parasitic like those?
Yes, there's loperamide, which is Imodium. The reason that it's sold over the counter, even though it affects your opioid receptors, is because it can't get through our blood-brain barrier. Is that correct? And so that would also cause toxicity in ivermectin-sensitive dogs. Loperamide, I know there's more I can get back to if you want me to send a full list. Devin.
It's kind of a two-part question. So when issuing treatment, do they recommend lowest dose to start at the beginning, and then when you are treating, at what point do you stop?
That's a good question. They actually do not recommend, it's not a tapering thing where you start at a low dose and continue going up. And as I said, with localized demodicosis, a lot of times you won't even treat. So there's different options, and that's one of the reasons that demodicosis is such a troubling disease, is there really is no one right answer for treatment. You start at a very high dose, like when you're using ivermectin, you start at a very high dose, and you're going to continue that until you see a negative skin scraping, and you're actually going to continue. Some resources said 2 weeks past treatment, some resources say 2 to 4 months past treatment. I'm sure every practitioner has their own idea of time that makes them feel comfortable, but I would say, you know, as long as the dog can handle it, a good 2 to 4 weeks past it, negative skin scraping would be what what we do. Does that answer your question? Okay, fabulous. Yes, ma'am. That's a great question. She asked if with dematicosis, is it a skin thing, or can you see these mites other places? Well, as I mentioned, it can cause a pododermatitis or an otitis externa. I have not run into any research about it causing internal disease or like internal parasitic problems, but that would be very interesting if it did, but I don't believe it does. I'm sorry, in the feces they find the mite? Oh, in the lymph nodes. That's very interesting. I haven't heard of that in any of my research, but that's very interesting. Good to know. Thank you. Dr. Junior.
You mentioned Amitraz side effects.
Yes.
Is there an antidote for those side effects?
There absolutely is. Yohimbine is an antidote for Amitraz. And actually, some research suggested that we use Yohimbine prior to treating a sensitive dog. I'm not sure about that. It was something that one of the researchers mentioned. I had discussed it with you. I know Dr. Junior, and I don't know that it's the best option, really. If you've got a dog that's sensitive to Amitraz, I personally wouldn't risk giving it Yohimbine first and then doing the treatment anyway. But yes, if you do have that excessive, the excessive signs of Amitraz, you can use Yohimbine, or adapanosol is also recommended. Sorry, John, and then Dr. Gaskins.
I had a question. You had on the treatment list vitamin E. Why would vitamin E be a choice?
Because that's a very good question. Vitamin E actually has some antioxidant properties, and because of the research that's recently come out about Demodex mites releasing free radicals, the vitamin E is kind of an attempt to negate that, I guess. But it definitely is not recommended as a sole therapy. It's more an adjunct, and I feel a little bit more like it's to make the owners feel better, like they can do something, because like I said, there's really no one right cure, so there's a lot of combination cures that are recommended. Yes?
When I was in practice, we used a topical treatment for localized Demodex. Are you saying they're not recommending that anymore?
A topical treatment. Are you talking about benzoyl peroxide treatment, or?
No, it was a specific
No, I have not seen the major treatments that I'm seeing. Like I said, were the Amitraz, as well as the ivermectins, the milbemycin and ivermectin. With with localized dematicosis, there was a benzoyl peroxide topical treatment that is often recommended, but usually it'll go away on its own, and we just give it to owners to make them feel a little better. I have not heard anything about that as of.
I think Dr. Nero was answering your question.
Are you talking about rodent now?
Yes, I am.
It's an natural insecticide.
Okay.
Because 90% of the cure, all you're doing is selling snake oil to clients.
And Dr. Dunare and I had talked about that a lot of vets, clients don't want to hear this is going to go away on its own when you have areas of hair loss on your dog. So we are sometimes more willing to say, okay, this isn't going to hurt them, it might make you feel better, that's what's important, we want our clients to feel good, so that might be the reason we do that.
So in your research, you didn't see any information that said that this is a placebo effect, or this is going to cure anyway, or it
Absolutely,
actually is?
no. Benzoyl peroxide I saw over and over again, and really I think that's because of the secondary pyoderma that can come with it. So that's maybe become more of a popular option.